Today I will talk about dengue fever. Dengue fever is a viral illness caused by the dengue virus Dengue, which is transmitted through the bite of infected Aedes mosquitoes, primarily Aedes aegypti and Aedes albopictus. The disease is prevalent in tropical and subtropical regions around the world and can range from mild febrile illness to life-threatening severe dengue, formerly known as dengue hemorrhagic fever. Dengue has become a significant public health concern in many countries due to its increasing incidence. Dengue fever is caused by one of the four serotypes of the dengue virus, Dengue 1, Dengue 2, Dengue 3 and Dengue 4, all of which belong to the flavivirus family. A person can be infected with dengue up to 4 times in their lifetime, as immunity to one serotype does not protect against the others. Transmission occurs through the bite of infected Aedes mosquitoes, which are active mainly during the day, especially at dawn and dusk. The virus spreads rapidly in areas with dense mosquito populations, poor sanitation, and stagnant water where mosquitoes breed. The incubation period of dengue is typically 4 to 10 days after the mosquito bite, and the illness can last for up to 7 days. The clinical presentation can vary from mild self-limiting symptoms to severe disease. The key clinical features include sudden onset of high fever reaching up to 104 degrees Fahrenheit, lasting 2 to 7 days, severe headache and pain behind the eyes, severe muscle, bone and joint pain, and that is why often called break-bone fever, nausea, vomiting and fatigue. A maculopapular or petechial rash on the skin may appear around 4 to 7 days of illness, often starting on the limbs and spreading to the trunk. Mild bleeding manifestations such as nosebleeds, gum bleed, or easy bruising. A small percentage of cases progress to severe dengue, which can be life-threatening. This typically occurs after the fever subsides and is characterized by plasma leakage leading to fluid accumulation, ascites, and pleural effusion, internal bleeding, gastrointestinal bleeding, or hemorrhagic shock, liver enlargement, myocarditis, or central nervous system involvement. If not managed quickly, it can lead to dengue shock syndrome, which is often fatal. Patients at high risk of developing severe dengue include those with a previous dengue infection, children, elderly individuals, and those with chronic conditions like diabetes. Severe dengue symptoms often come after the fever has gone away. These are severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums or nose, fatigue, restlessness, blood in vomit or stool, being very thirsty, pale and cold skin, feeling weak. People with these severe symptoms should get care right away. Tiredness and fatigue may persist for several weeks after recovery from dengue fever. Severe dengue can lead to several complications including dengue shock syndrome causing multi-organ failure, a significant decrease in platelet count, that is thrombocytopenia causing dengue hemorrhagic fever, liver failure, myocarditis or encephalitis in severe cases. If left untreated, severe dengue can result in death, particularly in children and immunocompromised individuals. There is no specific antiviral treatment for dengue and management is primarily supportive. Early detection and appropriate medical care reduce the risk of complications. The key components of management include paracetamol, which is commonly used to reduce fever and relieve pain. Non-steroidal anti-inflammatory drugs like aspirin or ibuprofen should be avoided due to the risk of bleeding. Adequate fluid intake is crucial, especially in patients showing signs of plasma leakage. Oral hydration solutions or intravenous fluids may be required for those with severe symptoms. Patients should be monitored closely for signs of severe dengue, including abdominal pain, vomiting, rapid breathing, bleeding, and fluid accumulation. Regular monitoring of platelet counts, hematocrit, and blood pressure is essential. Severe dengue cases require hospitalization for fluid replacement, monitoring of organ function, and treatment of bleeding complications. In cases of dengue shock syndrome, intensive care support is needed. Since there is no specific treatment, prevention focuses on avoiding mosquito bites and controlling mosquito populations. Prevention strategies include using mosquito repellents and wearing protective clothing, eliminating stagnant water where mosquitoes breed, such as emptying containers, covering water storage, etc., insecticide spraying in high-risk areas. A dengue vaccine, dengue vaxia, is available but is recommended only for individuals with a confirmed previous dengue infection due to the risk of severe disease in those without prior exposure. Dengue remains a serious global health concern, particularly in endemic areas, and early diagnosis and appropriate management are critical for reducing mortality. I hope this brief content about dengue fever is beneficial. If you like it, leave a thumbs up, share with your friends and colleagues. These videos are for you, so let me know if there is a certain topic you would like me to cover more in depth.